On today's show, we're discussing the real-world use of the first Alzheimer's disease blood test. This is the JAMA Medical News Podcast. I'm Associate Managing Editor Kate Schweitzer. Lead Senior Staff Writer Rita Rubin is here to talk about her story. Rita, thanks for joining.
Thanks, Kate.
So tell us about this blood test.
Well, the U.S. Food and Drug Administration cleared the first blood test to assess the likelihood of amyloid plaque in the brain a little over a year ago. The LumaPulse test, manufactured by Fuji Bio, is for people 50 and older who have Alzheimer's disease symptoms, and it's supposed to be used only by specialty clinics. Now, not that long ago, the only way to confirm that someone with dementia had Alzheimer's disease was an autopsy. Then two tools became available to help diagnose Alzheimer's disease while people were still alive. One is amyloid positron emission tomography, or PET. The other is a lumbar puncture to extract a small sample of cerebrospinal fluid. Both check for the presence of amyloid plaque, which is one of the hallmarks of Alzheimer's disease. Both are expensive, and neither is easily accessible for every patient. And of course, a lumbar puncture is pretty invasive. So there's been much excitement about blood tests to check for Alzheimer's disease pathology biomarkers, especially given that for at least some patients, it's more important than ever to determine whether cognitive impairment is due to Alzheimer's disease.
Why does it matter if someone with cognitive impairment has Alzheimer's disease or not?
Well, the main reason is that there are two anti-amyloid monoclonal antibodies available to treat Alzheimer's disease, but only Alzheimer's disease. You don't want to start a patient with dementia symptoms on anti-amyloid therapy if they don't have amyloid in their brain. Also, even some people who aren't considering the therapy still want to know the reason for their dementia symptoms.
And what does the test measure?
It checks levels of amyloid beta and phosphorylated tau, or p-tau, tau being another hallmark of Alzheimer's disease, and then the test calculates a ratio of the two. Test results are classified as negative, indeterminate, or positive, depending on whether the ratio falls below, between, or above the FDA-cleared cut points. However, a recent research letter in JAMA Neurology suggested that real-world use of the test could lead to an excess number of false positive or indeterminate results.
So how was this determined?
Well, the authors identified the issue by comparing the blood test results with study participants' PET scan or lumbar puncture findings. They attributed the problem to the lots of reagents used in their testing, which were different from those used in the clinical trials on which FDA clearance was based. To compensate, researchers at the Mayo Clinic, whose patients made up one of the two cohorts in the study, drew up their own cut points, which provided more accurate results. The research letter authors alerted test maker Fuji Bio about the problem, and the company issued a recall of the affected lots. The authors concluded that Alzheimer's blood test results, especially positive results, must be interpreted carefully because they could deviate from performance claims even when an FDA-cleared test is used.
So could a false positive blood test result cause patients harm?
Well, based on reporting I've done, I don't think anyone at this point in time is initiating anti-amyloid therapy solely on the basis of a positive blood test result. But, excessive false positive or indeterminate results could inflate the number of patients referred for confirmatory testing, namely a PET scan or a lumbar puncture for cerebral spinal fluid analysis.
Okay, and not all blood tests for Alzheimer pathology biomarkers are based on the ratio of p-tau to amyloid beta, correct?
Right. Some tests just measure p-tau, and p-tau 217 in particular seems to be a pretty useful biomarker for Alzheimer pathology.
Thanks, Rita. All right, if you'd like to learn more, we'll include a link to Rita's story in the show description. This week, we also published a piece that discusses new research that potentially expands the types of T cells known to harbor latent HIV in people living with the infection, which could have implications for a cure. You can find that and all of our stories at JAMAmedicalnews.com. Thanks to Rita Rubin for joining me. I'm Kate Schweitzer for JAMA Medical News. This episode was produced by Daniel Morrow at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening, and join us again next week.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.